so I would start off by performing hand hygiene, and then I would go into introducing myself. Hi, my name is Becca. I'm a student at Marywood University, and today we're going to be conducting a musculoskeletal exam. Can you please tell me your name and date of birth?
Laura Little, 11/17/1956.
And do you have any history of joint disease or arthritis?
Nope.
Do you have any joint or muscle pain?
Nope.
Alright, so starting off with inspection, her posture looks good, and so I'm going to have the patient stand up, and if you could turn to the side for me, and I'm going to have you put your chin down to your chest, and I will inspect right here and palpate down to C7. Okay, and it's good. So I'm going to test the range of motion of the neck. So I'm going to have you look up, and then look down, and then left and right, and then put your ears to your shoulder. Okay, and then I would move on to range of motion of the shoulders. So I would have the patient move their arms upward to their sides and place it behind their head and back down again, and then move them in front of you all the way up, and then bring them back down and place them behind your back. Good. And then I'm going to have you lift your shoulders against resistance. Okay, and then I would move on to palpating the shoulders. So do you feel any pain when I do this? And I would move down to the elbows. Any pain? Okay, nothing abnormal is noted. So I'm going to have you bend your elbows and then straighten them. And then rotate your arms. And then I'm going to have you bend your elbow against resistance and pull back. Alright, good. And the other arm. Alright, good. I'm going to have you flex your wrists upward and downward, and then bring them back up and spread your fingers out and back inward, and then place your hands straight and just move your fingers down. Alright, good. And back up, and then pull against resistance with your fingers. Good job. And then we're going to move on to the Tinel's test. So I'm going to have the patient's forearm upward and their wrist down. And I would use my finger and percuss right here over the median nerve. And is there any pain or tingling when I did that? So pain and tingling or shocking sensation could indicate carpal tunnel, and it shouldn't be felt. And we can also do the Fallon's test to test for carpal tunnel. So I'm going to have the client place the back of their hands together while flexing the wrist, and hold. And you would have the patient hold this position for about 60 seconds, and no pain should be noted. Do you feel any pain?
Nope.
Okay. So then we're going to move on to the spine. And so if you could turn to the side again, and I would palpate starting at C7 and palpate down looking for symmetry. Alright, good. And then can you touch your toes for me? And everything should remain symmetrical, and the spine should form a C shape, which as you can see it does. So you can stand back up, and then you look at the side of the spine. It's a little hard with a stretcher on, but there's no abnormal curvature. So I would have you face forward again, and place your hands on your hips, and bend side to side. And then without moving your hips, twist your body from side to side. Alright, good. So for the next part of this exam, you'd have the client lie down, and we would start by assessing the hips. So I'm going to palpate your hips. Is there any pain when I do this?
No.
Do you normally have any issues with your hips at all?
No.
Okay. So I'm going to have you move your leg one at a time outward and back inward towards your body, and the opposite leg. Good. And then I'm going to have you move your leg up one at a time and back down, opposite leg. Good. And then I'm going to have you bend at your knee and lift your leg upward. And then I'm going to have you move it outward and inward. And opposite leg, bend at the knee, flex it upward, move externally and internally. Alright, good. And then I'm going to have you push up against resistance. Other leg. And then pull in towards your body. Good. Good. And then I'm going to have you take your feet and point your toes together like this. And then outward. Good. And then I'm going to perform the straight leg test. So with the climb lying flat, I'm going to have you rise each leg to the point of pain. Alright, good. And put it back down and do the opposite leg. Good. So if pain was noted below a 45-degree angle, it could be indicated of the patient having a herniated disc. And then we can move on to the knee assessment. So I'm going to have you sit on the stand right here. Okay, and do you feel any pain when you walk or exercise in your knees at all?
No.
Okay, so I'm going to have you one at a time straighten your leg outward. Good. Other leg. Okay, I'm going to have you push outward against resistance. Outward. And then I'm going to have you pull inward. Alright, good. And good. And I'm going to have you lie back down. And we're going to perform something called the ballot test. So I'm going to have the patient lie supine, and I'm going to hold her patella with my non-dominant hand, and with my dominant hand I'm going to press on the patella. And there should be no movement of the patella, and the patella should rest firmly on the femur, and it does, so that's good. And we can also perform the bulge test. So I take my hand and push upward around 3 or 4 times, noticing for any fluid or bulge to occur above the patella, which it doesn't, and that's